A very good evening to you, our dear viewers. Thank you for staying tuned on Rest TV. I am Jackie Lingla, ready to dive you through the financial here every Monday from 8 p.m. to 9 p.m. Now, tonight we are tackling a silent emergency in Uganda. Mental health is one of the topics that is no longer a whisper. Not only in Uganda, but also globally. It is actually a very loud ringing bell that rings across classrooms, workplaces, families, and the economy at large. Now tonight with me I have a guest from National Planning Authority, that is Madam Judith Mutawazi. You're very welcome.
Thank you. Good evening, viewers.
We're very excited to have you tonight on our show. She's the Manager Population Program Coordinator, and we're going to be sharing insights upon the current 2025 population 2025 State of Uganda Population Report that was launched on the 19th of February this year. And we're sharing insights about mental health because it has been themed as a silent emergency, and we want to know how is mental health impacting the growth at large in Uganda. Why is the crisis becoming severe year to year, and what can we do about it? You're very welcome once more.
Thank you.
You could just give us a mandate of where you're coming from. That is National Planning Authority. What is the entity supposed to do for the Ugandans at large, in summary?
Good evening, viewers. Once again, National Planning Authority is the institution mandated with the developing integrated development plans, which are medium and long-term plans. That's why we develop the 5-year National Development Plan and the vision for 2040, so that we're able to give targets of development aspirations and see the Uganda we are seeing today be a better country, transformed to a middle-income country, and with better population, quality population that is able to work in this economy.
Now, recently, Madam Judith, you launched the 2025 State of Uganda Population Report, and you themed it Mental Health as Silent Emergency. Before we get into details, for the layman or for a Ugandan, a normal Ugandan who is watching us tonight, what do we understand by mental health in simple terms?
Mental health, in simple terms, it's not a normal state of occurrence, not of thinking right, kind of not able to concentrate, and not able to do the right thing. So you're kind of disoriented, not able to concentrate, and that also impacts on your ability to deliver, to think, to act, to do the right thing at the right time. So basically, it's that state of your mind which is not the normal, out of the normal.
Okay.
Yeah.
Are there levels? Is it the same as being mad?
It has different levels. Mental health has different levels, and of course there are different definitions. There are different types of mental illnesses, and one of the different, over about 12 types of mental illnesses that we have in this report, and we have issues of like disorder like bipolar, that is lack of concentration. Okay. We have people who are using drugs and they are high. Alcohol use can also make you put you in a kind of different mental state. And also we've seen people who have been affected by GBV and they are kind of unstable. We've seen people who are stressed. Stress is also a kind of type of mental illness. Depression. And people like who have chronic diseases also tend to have those kind of conditions like stress and depression. People chronic illnesses like HIV, AIDS, non-communicable diseases also tend to develop stress. So there are different types that are defined under Ministry of Health. Okay. That are symptoms of mental illnesses.
So why is the 2025 State of the Population, why did they dedicate it to mental health specifically, yet there are other issues that we have in the health sector?
Yeah, one of the issues why we are calling it even a silent emergency, I think it's something that we have not really appreciated in our society. That is something that hinders a human being's ability to perform in better than he could. So it affects one of the program we have at the NDP4 is human capital development. Okay. So for that is looking at having healthy, educated, skilled and employed population. So for a person to be able to attain that level of quality population, we think they should be in a normal mental state. And we realize this is something that is affecting the whole human life cycle, from children, from adolescents, from working age group, to older persons. So for us to achieve the quality population we want as Ugandan, this is something that is eating up majority of our population. And we thought it's the right time to address it because it's also hindering us attaining our development goals.
Okay.
Yes.
Now, given, of course, the research over the years, it looks like the numbers are a bit rising each year. What do you think is the reason for these sharp rises of mental health issues
Yeah,
in the country?
there are various causes of mental illness in Uganda, and we discovered in the report the major causes is poverty. People are poor. When you look at the population, when I don't have money to even buy a meal, when I don't have money to even pay rent, I become hopeless. So all that contributes to my stress and depression or my mental incapacity to be homeless and on the street. They find me walking, they think I'm a bad person, but it's really mental illness. So poverty is one of the key contributors, but we also we look at stress among adolescents related to drug abuse. There's increased drug abuse among our youth, maybe because of the availability of drugs or affordability, but also it's something that we see it's causing because prolonged use, they are not regulated, their doses are not regulated, maybe out of peer pressure, and it's impacting on their brains. Okay. We also see a lot of alcohol use among the youth, which is also ultimately the result will be disorienting their brain and they have mental illnesses. Then we also see work-related stress. At workplace, the pressure is too much, deadlines, meeting targets, or losing a job. Okay. And people become hopeless because you're the bread earner at home and then you lose a job, so someone gets a bit disoriented. But also we see a lot of that related to employment levels. Uganda, we have a lot of high unemployment, especially among the youth. Unemployment is at about 16%, based on higher than the national overall unemployment rate, which also makes people lose hope. They need jobs, they finished school, and they're out there searching for job 1 year, 2 years. There's a study we did and we realized actually the majority of we have what we call youth needs. The youth who are not in education, who are not in employment, who are not in training. And recently the census report put it at 51%. It has increased from 46 to 51%, which is a time bomb. So we are saying, how do we help these youth needs who are transiting from adolescents into working age group, but there are no jobs? So that also makes them a bit frustrated. They're spending 3 years on the street. That's what the study was saying. Then they eventually become real youth needs. You lose hope and you stop searching. So out of that, you get frustrated and you engage into either alcohol to reduce on your stress or drugs. Okay. And that's what is causing some of this. Of course, there are also other issues like food insecurity. We sometimes experience with drought or famine, and people are displaced. So those are some of the socioeconomic factors that contribute. But we also have family level social factors like gender-based violence, where it can lead to a family breakdown or children being abandoned, and that causes stress either that family members that are being affected, whether it's the children, whether it's a man, whether it's a woman. So those are the real causes. These are things we live with every day in our homes, in our lifestyle, at our workplaces. And it's not like a mad person has to fast and race, but it's kind of a higher level, defined level of madness, but then it starts with some stages.
Okay.
Yeah.
Talking about addressing, how is the government going to intervene on some of the issues like you mentioned? For example, the pressures at the workplaces, because those developed countries we are picking a leap from have laws where someone can sue a company for being mistreated. How is the government going to really intervene to see that the laws that we have as a country are actually working? Because I know they are there.
Yes.
Yeah.
I think one of the policy proposals also in the report, we need to ensure that we address the gaps in the policies, laws, and legal frameworks. Some might be there, but they have the gaps, but also we need to enforce the laws, because the laws could be there, but the workers getting, for example, working the recommended hours, are they getting the right benefits? So that if the contract ends tomorrow and someone is terminated, it doesn't become hopeless on the street. There's kind of a social protection, a fallback position, and workers are oriented and also supported to ensure retirement. We have issues of retirement in older persons. Tomorrow the job ends and then the person can't even support the children to finish university. So those are things that, as we look into implementing some of these policy recommendations, we need to ensure we implement, enforce, and support some of these proposed interventions to be implemented.
Okay, now the report also highlights that many Ugandans still associate this illness to being a superstition or a stigma. How is the National Planning Authority planning to challenge this perspective to ensure that we have a supportive environment for every Ugandan?
Yes, currently most of the mental health services are provided at national level, like Botabika Regional Referral Hospital, but at some other also referral hospitals, but not towards community level. So one of the recommendations that is coming up, we are saying let's integrate these services in primary health care, but also community-based services, because that is where our people live at communities, and these cases should be identified and able to be treated from health center 3 upwards, not to wait to come to national level. So maybe that would help the stigma, because when there is no system that is able to capture and help support these patients, then they end up saying, this is someone who is already wasted. We shouldn't care about them, but they need to be told that some symptoms or cases can be treated. But also stigma is also affecting people to seek services. So probably if the service is at community level, a community worker can identify this person in a community and be able to support this person to go for either treatment or rehabilitation. Because stigma, it's because we associate the disease with maybe witchcraft or a failure in society. So people feel shy to seek services, or, okay, I'm drinking, but what is causing this person be an alcoholic? So we need to also have those integrated services to be able to support the victims of mental illness.
And now, before we go into the tenfold growth strategy, you've talked about the community now, at community level, which could actually also help out at family level.
Yes.
Now, I'm more interested, because now we have mental health issues in institutions. How is the government going to tackle that? Because institutions are big. For example, the universities, we have thousands of students there. How are we going to zero down and identify this character might be having a mental health issues? How are we going to identify those individuals in institutions, and how are they going to be helped in schools, in institutions? Because those are quite a number of youths.
Yes. So
how are we going to monitor that?
When we say integrated services, because sometimes someone might not accept that actually has a mental illness, especially when it's stress. You'll be like, okay, I can work longer hours, I have 2 hours of sleep, it's enough, but accumulated less time of sleep, resting the brain, can impact you in one way or another, which you might not understand. But some people might not understand.
What are some of the quick signs? Because some of us might be having mental illnesses when we don't know.
No, the quick signs are actually defined in some of those already 12 types that were identified in the report. Okay. But of course, it takes more in-depth observation by the medical doctor to understand that this is the type of mental illness this person is experiencing. Because it might be, you can say, I'm okay, when I take alcohol, I feel fine.
So is stress a mental illness? Because some of us are given stress pills.
Exactly. By the time you say, I can't sleep until I take my pill, already that's a mental illness.
Okay.
That's kind of a depression or stress-related issue. Otherwise, you should be able to go to sleep naturally and wake up your 8 hours.
Okay.
Yeah, so by the time you sleep under medication, already you're having some mental illness.
Now at institution level,
but at institution level, this is something that should be integrated in HR manuals, because counseling and guidance, it's a day-to-day issue that we need to support your workers. So I think that is something that has to be part of the workplaces, as well as we're saying also other stakeholders, like you're saying you're part of the church, and you also support, because it can't be done by only government. The HR will do their work, but when you go back to your community, how is the community supporting you? How is the religious leaders supporting you? How are cultural leaders also supporting you? Because they should not also, cultural leaders, say that they can manage your case. It's a witchcraft case, yet it's actually a medical case. We've seen such cases. And then we've seen also cases who are like, I will not seek medical services, I'm going to pray about it, fast about it, and get better. But you can have a multi-thronged approach. Seek medical, do the psychosocial support with counseling and the support by the church, and then you'll get able to. So those are the integrated services we are looking at.
Okay. Now, as we move towards our vision for 2040, how is the mental health affecting our tenfold growth strategy?
Yeah, mental health, it's affecting because we're looking at already the amount of money we are losing. By 2020, when I look at the report, by 2020, we're spending about 283 billion loss of the money we're investing in managing mental illnesses. And by 2023, it had risen to 296 billion. So, and the report projects that we shall be spending about 8 by 2040. So meaning...
Billion
yes,
dollars, shillings?
Uganda shillings, sorry.
Okay.
Uganda shillings. So that means this money we are putting into treatment and rehabilitation. If we prevented now, this money can be used for other things instead of just spending it in treating people. Yet we can look, because when you look at in our NDP 4, we are also looking at using the preventive approach more than their treatment, because there are illnesses which can be prevented than when they have become complicated to manage as treatment, and you have to spend a lot of money going to hospital, treating, medication, all that, rehabilitation, yet it could have prevented. That's why that community integrated services can come in to prevent some diseases at community level, at household level, before they are transferred to health centers.
So in the report, you're positioning mental health as a development issue.
Yeah.
What does that mean in practical terms?
Development issue is the related one to the cost. We don't want to see a lot of money going into spending into treating these mental cases, but we want to save it and use it for other investments where we have gaps, because you know our fiscal space is reducing, we have a small budget, and we borrow to finance most of our investment. So how do we save on some of these costs, use it to treat illnesses, and it's able to address maybe improvement on education service? We have other gaps in health sector, other departments. So how do we manage? But it's also a development issue, because development, we are looking at labor, people who are quality people, who are morally upright, who are healthy and able to work in the development process. So if we are saying we have like 51% of the youth and there are no jobs, okay, and we're seeing a lot of people are getting stressed because they are losing jobs, or they don't have jobs, or there's also some cases under education system, the pressure of the education system, or children getting into managing even boarding schools, maybe overcrowding of some schools. So those are some of the cases that are coming up, and we're like, how do we manage? So it's affecting our people. It's a development issue. Children being abandoned. If a child is abandoned at age 5, 6, this is a person who should be the future leader. If children are getting into drugs or alcohol addiction, these are the youth adolescents we think in the next 30 years they'll be taking over as we retire. So it becomes a development because a certain percentage of our population are not really becoming more productive.
Now, of course, Uganda being predominantly youthful in terms of demographics,
Yes.
how should the government and the community tackle the mental health issues that are directly to the youth? For example, you mentioned one of them is drug abuse. How will the community and the government work together to ensure that a youth can actually forego some of those addictions and make sure that their mental state, by the time they are out of the youthful bracket, they are actually able to be a productive Ugandan?
I think government has put in place a number of policies. One is to ensure all the youth complete education. We are saying in NDP4 we need people to have 16 years of education, and there we are looking at the 7 years for primary, the 4 years for secondary, the 2 years for HSC and university, so that they are able to be productive people. But also evidence has shown that the longer like girls stay in school, they don't get pregnant to fall out and they get into those bad habits that are going to cause depression or stress or HIV or GBV. So we are saying if their education can manage them at that level, we are able to reduce on that. But also Ministry of Education has put in place a guidance and counseling department which supports most of these youth in school. The out of school, the Ministry of Gender is also handling. How do they provide skilling to these youth who have dropped out of school? How are they providing financial startup? That's why you see programs like PDM, programs like youth livelihood programs, women empowerment program, Yoga. All those are to provide affordable finance capital to help them at least have a form of employment and earn an income than being wasted away. So government is trying its best to put in place some of the skilling hubs that have been put in place under Office of the President, but we also have industrial hubs that are being developed to create jobs for most of the youth. But government is not working alone. We work with our partners, and our partners are CSOs, NGOs, religious institutions, cultural leaders, because kingdoms also have influence in making pronouncements, what they want their youth to be, what programs they have in place to support these youth. So government is not working in isolation.
That is well said by Madam Judith Mutabazi. As we are tackling issues concerning mental health, it's no longer a separate when it comes to population planning. It has been identified as a silent emergency issue that should be tackled because it's affecting the economic growth at large and of course the human capital. Don't go away, we'll stay tuned. We are going for a commercial break. We'll be diving deeper through these mental health issues so that we can have a smooth transition as we move towards our Vision 2040. Stay tuned.
The Financial Eye, making finance clear, no complex.
Welcome back from the commercial break. I am Jackie Lingla. Welcome back to the Financial Eye. We are still digesting or discussing about mental health, which is no longer a whisper in Uganda. It's no longer a whispered topic, but it has been identified as a silent emergency by the government of Uganda, which is hindering our growth as a country and needs to be addressed as soon as possible because there are sharp rises in the issue. And of course, we're going to be discussing how the government is putting up interventions to ensure that this issue is handled and people stay in a well mental state as they remain productive in their workplaces and also as they attain their education at large. And now, Madam Judith, you're welcome.
Thank you once again.
As you know, we've had a problem concerning the health sector in terms of being able to carry the capacity of health issues in Uganda. How is this going to be handled? How are we going to ensure that the mental health cases are covered at large?
Yes. One of the gaps that we've identified is the human resources for health to provide the service regarding mental illnesses. So the report says we have a gap of about 5,300 staff that are missing in the approved structure to provide the services right from health center 3s at community level. So we are saying, how do we fill up the gap, have the right manpower, and the right manpower, but also create remuneration for those already handling the services, because this is already provided under primary health care. Those are the lowest community services that are provided at community level, and it can be provided, it's already provided under maternal health care, under NCDs, so how do we support those already structures that are providing? But we see that demand is increasing with increased mental cases, and the existing staff cannot manage all the cases. So we really need to mobilize for increased resource allocation, but also recruitment of the right manpower to provide the service.
Now, in your report, you highlighted about the village health teams. What is the role of those guys?
The village health teams really provide primary health care, specifically focusing on maternal health. Maternal health there, we're looking at they mobilize people at household level to ensure they access services which include immunization of children, nutrition, people who have non-communicable diseases like hypertension, HIV, AIDS, diabetes. How do they access some of these services? But initially, the village health teams are supposed to mobilize people to manage those preventable diseases that can be managed before it gets worse, or if they are identified at community, they can be taken to the health center to seek support and treatment or rehabilitation. So that's why we're looking at integrated community services. We have structures of the village health teams. We have the CHUs, the community health extension workers. And how are they going to work together?
Are they going to enroll more people?
Yes, the plan is to expand because we have a gap. We've identified a gap in the report. And how do we advocate for increased recruitment, provision of wages, but also medical supplies, because these people, might mobilize them and they reach in the health center and there's no medication or the health workers to attend to them. So we need to ensure this integrated service, if they need counseling, then the services should also be provided for at the community health centers. Before, along the pathway, if it's a case that can't be managed at a community level, then it's referred to health center 4. If it can't be managed, then it can be. So the referral pathway all should be functional along the way. Then if the case is more complicated and it needs a regional referral hospital or a national hospital, then the referral system should be able to manage. Because right now we see like Uganda Hospital is a bit crowded. It's overwhelmed because everyone with such case goes to Uganda. But the cost of transporting someone from West Nile or someone from Kisoro, if the services were provided down there, then we will not get congestion here. And we're also saying, can we have also regional centers that provide their services, at least to be able to manage cases at regional level.
I know you a bit explained this one, but I want you to go in depth. For example, I have a family of like, you know, in the rural areas that they have extended families.
Yes.
Maybe I have about 15 children, and I'm identifying 2 of my children have signs that they are not mentally okay according to my standards. How am I going to access these services? Do I just go to the regional? Do I go to the LC person? What did you mean by the community-based approach? Could you identify to that level? Like if someone has an issue here, this is where you would definitely get help from, maybe from there, just for someone to understand the process.
Yeah, the community, like village health team, is supposed to identify these people, whether at the households where they stay or whether it's in a school, and they provide support.
So the village health team will have
or the extension workers. Not a survey. This is what work they do every day.
Okay, so
these are health workers.
Those
actually
are known by
the lowest health worker at community level, and that is what the work they do.
Okay.
To be out there in the communities, identify the different cases there, sensitize communities about some of these preventable diseases. Have you taken your baby for immunization? You should get an immunization before it's 2 months, should get another one. If you have an immunization card, you're supposed to take the baby after 1 month. Have you taken this baby? Do you have a latrine at your household for sanitation purposes? Do you boil drinking water, or you take it non-boiled? Do you bathe, or you have jiggers? These are health workers really that are supposed to provide services that are preventable, even at household level, to reduce the burden in the health centers. But if the cases have already been escalated, then they can refer them or advise them what to do. So they also provide those advisory, counseling, guidance, that kind. But they're health workers. They are part of the health system, and that is the lowest health structure, and that is how they are supposed to support referral. So once these people are referred to the health center, then they seek treatment. Or those who need further rehabilitation, then they are guided to further referral, then they go through the system.
For those who cannot totally afford, because there are people who can't earn $1 a day.
I know.
Are there health services that are free for them?
Actually, primary health care services in Uganda, they are free.
Even for the mental health issues?
Yes, it's part of the integrated minimum health care package that is provided. It's free service. The only challenge, as we said,
no medicine.
Even the human resources, we have gaps. You might get there. Maybe some of these specialized cases, they can be coming, they have a specialized day, like once a week, even at national level, where they attend to certain cases, apart from Butavika, which is full-time. So because of limited human resources, but also you might get there and they've run out of drugs. So you're forced to buy the medication at a private pharmacy. That is where the complication will come in, because someone might say, okay, I'll not take it, let me take my alcohol and sleep, or let me take my, what is this, rock boom, and sleep. Anything, they will take anything, and they'll say, that one puts me to rest, I will be happy.
Let me take Sting.
Exactly, and be happy. So that is the problem, and as I said, stigma also causes that, like, how do I take medication for stress or depression? I'll manage it, but before you know, it accumulates, and then it's impacting on your health as well, your brain, your thinking capacity, your capacity at work, your health, everything in the long term.
Now, in your plan, you integrating the mental health services into the national health plans. Is there a timeline for this process?
Yes, whatever we are doing contributes to the Human Capital Development Program. We want to see a healthy, educated, and productive population in Uganda, and that ultimately contributes to our NDP4. Our NDP4, we are in the first year of NDP4, it ends 2025-2030 financial year. It's a 5-year plan, but annually we have those targets we've set and we monitor implementation. So that is the plan. Why we are implementing this, we need to see our productive population, our quality population, but also that is also in line with our vision 2040. What is the population we want to see by 2040?
So how is the data from this report going to shape the future of Uganda in terms of policy making?
It's definitely, we have policy recommendations in the report that we've come up with. One of that is to train personnel, as you've said, and that will, the report was launched by the Minister of Health, Honorable Ruth Acheng, and she already committed to ensure, address some of these policy proposals and findings. They need to expand infrastructure for mental health, because right now, as I've told you, it's only Butabika, the National Referral Hospital. So someone should not drive all the way. It becomes very complicated to take care of a patient who is admitted in Butabika and you live like in Karamoja. So how do they decentralize some of these mental clinics, at least at regional level? So we need that infrastructure to happen. But also we are looking at, as I said, training the personnel to provide the service. We also need integrating the services in the community system. They are already there, but as I said, most of these VHTs were recruited to address issues of like maternal health, where you're looking at children dying because of not immunized or nutrition or breastfeeding mothers. But how do they expand their scope? And they are supposed to help all households at community level. Then we're also looking at issues of repositioning Butabika Hospital to do more research and training in mental health, and they're able to support those other regional health centers. So that they are not overburdened. Already they are overwhelmed by the demand, increasing demand of cases and population. So how do they decentralize the services, but also plan to address the gaps that exist?
Okay.
Yeah.
Now, we've heard of the long-term plans and some of them are short-term. Now, specifically for these two, the anxiety and depression that is among youths, especially the teenagers. Recently, we have seen, not even recently, now we are seeing stories popping up where children feel like they want to commit suicide because they're given little or small pocket money, and they feel like they should get more than what the parents have, provided, and they want to commit suicide. They are depressed about particular things. How is the government going to come up with strategies that are not long-term, that are actually addressing some of those key issues? Because now those, they will grow, they will come up even before you predict that now this one is turning to, you're taking her to school and she wants to commit suicide out of the blue. What should the parent do? How is the government going to equip us as family people to ensure that if in case a child has a mental illness of not being able to conform to what the standard of the family is, how am I supposed to handle as a parent? How is that information going to us?
Yeah, I agree. One of actually the causes in the report is internet addiction, of causes of mental illnesses, internet addiction, and we see that happening in a lot of adolescents and youth. Of course, it's a generational crisis, which for me, my generation, we never grew up with phones, but these days I tell my daughter that please put down the phone. But yes, it's like they feel life cannot happen without a phone or a tablet or a laptop in their life. So it's something.
During the lockdown, people are depressed.
I know. Just the 4 days they switched off. People were not thinking straight. I mean, it's a mental illness as well. If you look at the descriptions of what the types of illnesses in the report, and it's very worrying. If you look at countries like recently, there's a report from Sweden. They've started regulating hours, and they've banned even use of computers in school. They are going back to analog because they thought it was going digital was a modern way of even teaching in class, online classes, learning from a tablet, but they are seeing that it's affecting their brain development, level of concentration, and articulation of issues, thinking, and it's a big thing. So even government has put in place regulations under UCC, but I think before we didn't see this coming, we thought having, actually one of the policies was to have internet in schools, let's have computers for our children in schools, but then countries who moved faster, now we are seeing the implications. So some of these policies, as we put them out there, we need to see what are the pros and cons of some of these policies. But UCC is regulating, especially the information that is shared out there for a certain age. They should be regulating that. The parents also, you can also put regulation. If you bought your child a phone, you bought a laptop, there's parental control. We've seen that also on some TV channels, parental control. How do you regulate the information your children are watching at home? You can put codes, you can limit hours. I've seen even parents at dinner time, everyone is having a phone. If it's dinner time as a family, what are the rules in the house? Because government will not be in your house every day, will not be in school, will not be in office, will not be working after you. But also, this is something we need to do. Government, yes, will put policies and laws in place to regulate. But also parents, we have a role to play. Schools have a role to play. Community has a role to play. And of course, as government, we are seeing this in youth. It's a bit frustrating. In adolescence, it's kind of, I think, a generation crisis, but in youth, it's more related with losing hope because there are no jobs. That's why they resort to drinking and drugs. So we are also saying we need to put enough jobs in place. In our NDP4, we plan to create about 300,000 jobs every year to absorb the people who are transiting from school to working environment, to a working age group, because as you said, we have a big population which is belonging to children and youth, but then we need to see more into working age group also transiting there but getting jobs so that they are able to work and contribute to our tenfold growth, because we can't achieve it when we are having a population that is consumptive. They are not working. We are spending a lot of money on them, but they are not contributing to the tax base. So that's where we are saying for us to achieve our dividend, we need a more working age group that is able to work and contribute to our tax base.
Now, how will the culture factors also influence the implementation of these mental health policies?
Culture, yes, because cultural institutions also, when they make pronouncements of how they want their people to be, they also influence, because they are powerful, they listen to them. If you say, please make sure you start a business. Of course, we see a lot of people also in subsistence agriculture experiencing high increased mental illnesses. And of course, that is poverty related, because subsistence, they're only producing for food. How do cultural institutions help their people at community level to start producing and saving for tomorrow, or having an income, and they're able to access the basic social needs, which is basically health and education? Because the more they stay in subsistence, then the more. But also culture, as I said, the witch doctors have confused people about, like, they can manage mental cases. Sometimes it's a belief. Yes, maybe they help, but if you believe that, yes, I'll get here, this person can help me, it can happen. But sometimes they mismanage certain cases. So we need to also understand where our boundaries stop in managing different cases. But they also have a role. They are key stakeholders in talking to their people about the right way to do things, the right way to manage certain cases if they happen, so that their people are productive.
Okay. In your closing remarks, what will you say to our viewers who are watching us tonight?
Dear viewers, we should know that mental illness, it's not for being mad and racing on the street. Mental illness affects majority of us in our workplaces, in our homes. All of us, we are even vulnerable to a minute falling away to one of these mental illnesses, whether it's depression, anxiety, or any addiction. So we should take it a serious issue. We should not look at it as something that someone is acting up. It's something that should be managed properly by professional health workers and also other complementary services like counseling, psychosocial support, strong family support, because we've seen cases coming up out of like family breakdown or GBV cases. So how do we have a multi-thronged approach of managing some of these cases? So let a neighbor help the other, and we support this silent emergence that is going to affect our population. Thank you for listening to me.
That is well said by Madam Judith Mutabazi, who has explained well about the 2025 State of the Nation Population Report that was launched on the 19th of February 2026, where mental health has become an emergency situation in Uganda. It has to be addressed as soon as possible so that all Ugandans can have mental stability to ensure that each and every one of us is productive in their workplaces, we attain our education, and of course have stable families, so to ensure a full economic growth throughout all sectors and all regions in the country, so that we can move towards our Vision 2040. That is well said by me, Jackie Lingla. Stay tuned on Rest TV as always. Until next time, every Monday from 8 p.m. to 9 p.m. Have a very good evening.